Welcome back. Remember when e-cigarettes entered the market? They were introduced saying they were much less harmful than traditional cigarettes. Now, after being on the market for a number of years, are e-cigarettes bad for the heart? Joining us this morning is Baptist health cardiologist Dr. Scott Davis, who is always looking out for us with the latest research. Dr. Davis, thank you for being here.
Good morning. How are you?
Pretty good. So we've heard that e-cigarettes are a good alternative to regular cigarettes. Talk to us about that.
Yeah, so when e-cigarettes or vaping first came on the market, they were promoted as being, 95% less harmful and safer than cigarettes. And the issue with that is formal toxicology studies weren't really issued or done on the effects of vaping and e-cigarettes on the circulation, and specifically on the endothelium. That's the inner layer of the artery to your heart, the artery to your head. And we're showing more data now that, in fact, e-cigarettes do impact the endothelium, causing what's called endothelial dysfunction, which is the early changes to cause then what's called oxidative stress, and then the buildup of plaque, and the precursor for developing heart blockage or stroke. And so it's so new in its infancy. We don't have 10 and 20 years of data like we have for cigarette smoking. The other issue is there's this concern about conflict of interest as far as who has been doing these studies. When the tobacco industry issues their studies, there's a 95% reduction in safety. However, when industry is doing studies, we're starting to see maybe some concerns about harm. And so then you look at it as a gateway to getting off cigarettes, because that's how it's promoted often, is like, well, you can vape or you can do an e-cigarette, and that'll be an alternative to smoking cigarettes. Well, the problem there is, in a big study using that as a tool to get people off cigarettes, then 45% of the people in the study arm were doing both. They were smoking cigarettes and vaping. And so at the end of the day, the concern is over nicotine. And nicotine is a strong drug. I mean, nicotine's a real drug just like alcohol is. And so getting off the nicotine is really the challenge here. And so if you are struggling with cigarette smoking, then talk to your doctor about nicotine replacement therapy, like nicotine patches. That is the best alternative, and it has the best results for ultimately getting you off cigarettes. The other concern then is as far as its impact on children, because we've seen an increase in use of vaping and e-cigarettes from a 2016 to 2023 time period with children. And when you see e-cigarettes being promoted as, also in bubblegum flavor, I mean, you kind of start figuring out the market there. So,
right.
It's also a conversation to have with your kids about, hey, look, nicotine is the crux of this whole thing. And you ask anybody who's either tried to get off cigarettes or try to get off, dipping, and they'll tell you it can be a bear.
As Dr. Davis just said, say no to cigarette smoke and no to vaping.
Amen.
Well, Dr. Davis, thank you so much for
Absolutely.
being here. You can contact him by going over to baptisthealth-.com or calling the Baptist Health Line at 1-888-BAPTIST.